Do your patients need to like you? Let me ask you a question. Which of the following better predicts the chance a doctor will be sued? A, a physician's training, credentials, and history of errors they've made, or B, listening to a brief conversation of that doctor with their patients. What do you think would better predict the chance a doctor is sued? You're probably thinking this is either a really silly question or the answer must be the opposite of what seems very obvious. According to a study in Malcolm Gladwell's book Blink, there is not a clear correlation between a doctor's clinical skills and the number of errors they've made with their chance of being sued. Some patients suffer from doctor negligence or doctor error, but they never file a malpractice suit. Why not? It turns out people don't sue people they like. The way the patient was treated by the doctor during and after the incident was far more indicative of the chance of a lawsuit. During malpractice suits, patients describe their care using terms like rushed, ignored, treated poorly. The patients describe how the doctor treated them as a human being. They don't focus on their clinical decisions. Why am I telling you this? Why should this matter to you? If a patient's decision to sue has to do with how much they like the doctor, then the patients are probably making other decisions based on how much they like you. How much they like you can affect if they stay loyal to you as a patient. It can affect if they trust your recommendations, refer their friends and family, or move forward with new treatment. It doesn't make logical sense, I know. It would make much more sense for patients to choose their doctor purely by their ability and their experience, but that's not what happens. Instead, people make decisions based on how they feel cared for and how much they like you. Your personal interactions with your patients, it matters. The words you use, the time you take with them, and how you treat them as a person, it matters. In Malcolm Gladwell's book, he describes a study done by medical researcher Wendy Levinson. Wendy recorded and analyzed the conversations of hundreds of doctors, half who had been sued multiple times and half who had never been sued. She found major differences when she analyzed these conversations. What did the doctors who were never sued do differently when interacting with their patients? What qualities made these doctors more likable and more trustworthy? The study revealed 5 major differences. First, the doctors spent more time with their patients. On average, they spent 3 minutes longer with each patient, 18.3 minutes versus 15 minutes. Second is these doctors were also more likely to make orienting comments to help guide their patient through the appointment. For example, those doctors would say things like, first we're going to do this, and then we're going to do this. Or, after the exam, I'm going to leave you time for questions. The doctors made orienting comments so their patients could feel more comfortable because the doctor was telling them what to expect. Third is these doctors are also more likely to actively listen by saying things like, tell me more about that, or go on. They made the patient feel heard and understood rather than interrupting them or jumping to conclusions. Fourth, these doctors were more likely to laugh during their appointment. What's really interesting is the amount of medical information was similar among both groups. The amount of medical information didn't affect the patients and their decision to sue. Wendy decided to take her analysis one step further. The conversations were then stripped from their content, meaning you could no longer understand the words that the doctors were using. You could only hear the tone and the pitch and the rhythm of the doctor. Each clip was analyzed for qualities like warmth, concern, hostility, dominance, and anxiousness. In 4 10-second audio clips, a total of 40 seconds, she could predict with great accuracy which surgeons got sued. What this should tell you is that your tone of voice and the respect that you show a patient, it matters a lot to your patient. It's the old saying, it's not what you say, but how you say it. These 5 insights are key to understanding what matters most to your patients and what qualities will affect whether or not the patients like and trust you. If you can implement some of these findings into your everyday practice, your patients will feel respected and comfortable in their appointment with you. They'll be more likely to stay loyal to you as a patient, refer their friends and family, and trust your recommendations. As a quick review, here are the 5 things that you can do to make your patients like and trust you more. 1 is spend more time with them. 2, make orienting comments. 3, actively listen. 4, laugh. And 5, use a respectful tone. Number 3, active listening tends to be difficult for anyone to master. To help you, I have a free guide that lists several active listening tips specifically for medical professionals. This list provides phrases and statements that will help your patients feel heard and cared for. You can print this out, share it with your team, and have it as a reminder of how you can make your patients trust and like you more.